Hello, everyone. Welcome and thank you for joining us today. My name is Shaylin Sluzales. Alongside me,
Germán Parodi.
And we are the co-executive directors of the Partnership for Inclusive Disaster Strategies. We also have our team with us today, Priya Penner and Melissa Marshall, and they will introduce themselves shortly. We'll begin by giving a quick audio description of ourselves. Again, my name is Shaylin. I use she, her pronouns. I'm a younger woman with light complexion skin and long curly brown hair, wearing a black top today.
And again, my name is Germán Parodi. I use he, él. I'm a brown-skinned Puerto Rican man in my wheelchair wearing a black turtleneck with my hair pulled back in a bun.
This is Shaylin. Why don't we have the rest of our team introduce themselves? We'll have Melissa go first.
Sorry, it took me a second. I'm Melissa Marshall. I'm Melissa Marshall, and I'm the Director of Operations for the Partnership for Inclusive Disaster Strategies. And I use she, her pronouns. I have long, what I call COVID gray hair, and I'm wearing an autumnal colored shirt today. Thank you. And now I'll turn it over to Priya Penner.
Of course, I'm on mute. Hello, everybody. My name is Priya Penner. I use she, her pronouns. And today, I'm a brown woman, with black hair. And today I'm wearing a black dress.
Again, we are very excited to be with you all today. Thank you to the April team for hosting this wonderful conference and make it an event that can be reached by all. And we are happy that you have joined us today. It's a very important conversation that we feel the entire country needs to be having at this time.
With that, we want to get started into our workshop today titled Inclusive Disaster Resilience During a Pandemic. We'll start by sharing a little bit more about the partnership. We are the only U.S. disability-led organization with a focused mission on equal access, disability rights, and full inclusion of disabled people, older adults, and people with access and functional needs before, during, and after disasters and emergencies. So essentially, we are the boots and wheels on the ground response. We are community resilience and capacity builders and disability rights experts before, during, and after disasters. We know that people with disabilities are disproportionately impacted during disasters, and that is why the partnership has a sole focus mission on the rights and needs and inclusion of people with disabilities and people with access and functional needs before, during, and after disasters and emergencies. Next slide, please. Today, we're going to get into some of our objectives, and we have a lot that we'd like to touch upon, and certainly we could talk about these objectives and pieces for hours, and certainly we will have a slide towards the end on other ways to get involved with us at the partnership and continue these conversations. But today, we hope to touch upon empowering community-wide disability inclusive emergency and disaster preparedness, mitigation, response, and recovery, understanding the disproportionate impacts people with disabilities face during and after disasters, and disability rights to advocate for, protect, maintain, and advance in systems emergency management advocacy, understanding, exploring, and discussing good and promising practices for inclusive emergency preparedness to work towards and advocate for in your communities, and understanding and advocating for the Real Emergency Access for Aging and Disability Inclusion, also known as READI, REAADI, for Disasters Act, and the Disaster Relief Medicaid Act, also known as DRMA, DRMA, in your community and nationwide. With that, we have a lot to get into today, and we certainly want to hear from you all. I want to also really emphasize for folks to add any questions into the Q&A. We will address questions throughout, so don't hesitate to put them in there, and we would love to address them. So let's get started first by talking about some facts. One thing that we say and love to educate folks upon in our communities, especially and inside and outside of the community, is that people with disabilities, disabled people, are 2 to 4 times more likely to die or be injured in a disaster or an emergency than non-disabled people. And this is largely due to the disproportionate impacts that we all face that we will touch upon in just a moment. And then also after a natural disaster, white people accumulate more wealth while residents of color accumulate less wealth. Also talking about the socioeconomic impacts and disproportionate impacts on multiply marginalized communities that we will touch upon as well. Priya, would you like to add anything there?
Absolutely. Just to add that this last fact really emphasizes, and just explain the last fact first. This fact is talking about how when communities experience disasters, communities that are predominantly white receive more resources and support than communities of color. And actually, at the end of the day, after the natural disaster has occurred and recovery is happening, those counties with predominantly white populations actually have gained wealth, while communities of color have lost significant amount of personal money, personal wealth, but also infrastructure and just safety. So that's, I think this quote really summarizes that, there's this huge disparity between communities of color and communities with predominantly white folks, and how these communities experience disasters. Shailene?
This is Shailene. Thank you, Priya. And to our next slide, if you will. As we continue talking about the disproportionate impacts, we have 4 bullet points on the screen on our slide deck. And I do also want to mention, I'm sure others have heard in other workshops you've been a part of, that these materials will be available on the conference platform following, or probably already are, I should say, the PowerPoint, as well as we've included a resource document, and we will refer to some of those resources throughout our presentation today. So as we, and Mary is correcting me that these resources are already on the platform, conference platform. So do check those out as well. But want to talk about, as we call it, quote unquote, in blue sky days, or when there's no disasters upon us. We all know that there are barriers to resources, to accessing resources, resources such as housing, our home and community-based services, access to transportation, food assistance, and financial assistance, just as some examples that we all know can be difficult to access without a disaster upon us, without perhaps a pandemic upon us. And when a disaster strikes in communities, that access to resources is disproportionately impacted, such as lack of access, like communication access, equally effective communication, such as evacuation alerts, being equally effective in communication, providing that equal access and in different formats for folks to be able to know those evacuations alerts, as well as physical access. When we think about evacuating, first is, well, where do we evacuate to? Is there a shelter near me that is wheelchair accessible, for instance? And maybe you know that information, maybe you don't, and that's certainly one place where we can all start conversations within our communities. But perhaps you get to a shelter and you find that there are steps to get inside, or perhaps there are no steps to get inside, but you cannot then get throughout the shelter to the restrooms that are inside, or the food area, or the sleeping area, and those pieces of accessibility. Then when we add on things like effective communication and having ASL interpreters at shelters, and other forms of communication and access needs, these things are the little details that we all, as disability advocates, know that we have to continue to fight for each and every day. And during disasters, that does not change. And certainly is why we have to have these conversations at all times throughout each planning phase, throughout each season, is connecting with those local emergency managers, our public health officials, folks that have decision-making power within our communities to make sure they are planning and incorporating these pieces of planning and recovery, as well as including us, people with disabilities, disability-led organizations like Centers for Independent Living across the nation in these important conversations. Other disproportionate impacts that our community faces during disasters is the lack of access to resources generally before, during, and after disasters, as we touched upon. Things like housing, home and community-based services, transportation, food assistance, financial assistance, those things that we are continuing to need each and every day certainly are impacted and disproportionately impacted during disasters. And as we mentioned prior as well, folks' socioeconomic status, people who are poor, especially people with disabilities, are more likely to be of lower income, and the financial assistance that's needed to evacuate, for instance, or to shelter in place somewhere else or in your home may require pieces of financial assistance that just may not be available. And that is where we are oftentimes falling through the cracks of needing resources in the most dire times. And people with disabilities and access requirements, as I've mentioned throughout these pieces, are often an afterthought, and why it's so vitally important that we all start these conversations within our communities if they aren't already started, get involved in them if they are inactive, and making sure that people with disabilities with lived experience are at these tables. These are all things that you all know that we have to keep doing throughout each system's advocacy and individual advocacy that we do, and certainly does not stop throughout disasters.
And the impacts intertwine. All of this often happen at the same time, and just something we can all relate to. In preparedness conversations, we are told, have a month or two extra of medication, have the economic support to purchase sometimes up to $1,000 of supplies in preparation too. These are things that our communities, most on fixed incomes, do not have the opportunities to, thus exacerbating the events when they occur.
Next slide, please. Priya, next slide, please. Oh, thank you. And we're going to sit on this slide for a minute, and the slide does read, civil rights are not waived during disasters or emergencies. And this is our mantra, the motto, what we continue to raise loud and clear for all who will hear and listen and absorb this information, because certainly it's something that we often find people outside of the disability community, largely emergency managers, public health officials, often forget that our civil rights are not waived during disasters or emergencies. And what we mean by this is all of our civil rights that we continue to fight for each and every day are continued to need to be upheld, enforced, monitored, especially when federal dollars are being put in response to disasters. And oftentimes we find that. And there are no waivers to our civil rights, especially when these federal dollars are in place. But I'm going to call on Melissa to talk more on this.
Thank you. Again, I live for disability civil rights. Civil rights are not waived. What that means is entities, whether it's a state or local government entity or a nonprofit organization or a place of public accommodation, a business, they still have to comply with their obligations under the Americans with Disabilities Act that exist already. They can't say, oh, we're going to comply, but this is a disaster. Or, yes, it's a disaster, so that's why we don't have interpreters there. Well, that's why you need sign language interpreters more. And also, as Shaylin alluded to, when there are federal dollars attached, there are always obligations under the Rehabilitation Act, Section 504, Section 508, other sections of the Rehabilitation Act. So there are always, always, always obligations. But sometimes I feel like, oh, everybody knows this. Until this winter, I was reading an op-ed piece from Hartford in the local paper, written by a physician saying, and she wrote great things. And she said, it's a shame that civil rights are suspended during disasters. She put that into writing. She was an expert in the medicine. She's not an expert in the law. We need to do all we do to debunk and dispel that myth. We'll comply with your civil rights later when we're not so busy. This is the time when it's most important that our civil rights are not protected and not delegated to charities. Thank you, Shaylin.
Thank you, Melissa. This is Shaylin, and also forgot to note that Melissa is one of our lead trainers on this topic, especially, and one of her favorite topics, I might add. And certainly as a lawyer and having that subject matter expertise, we really appreciate always having those perspectives and adding those highlights. Thank you, Melissa.
This is Melissa, and secretly she's thinking she only talked for a few seconds and we didn't keep her talking. She didn't keep talking for an hour. That's a good thing. So you're blessed.
And we have more opportunities, and we'll talk about that as well for folks to hear more. Anything you'd like to add, Priya, while we're on this slide?
This is Priya. No, Melissa and you all covered it quite nicely.
Great.
In disasters, as the pandemic became a nationally declared disaster, it was the first time in US history that the source of funds that support states in disasters through federal mechanisms is the Stafford Act. This traditionally in hurricanes, wildfires, so localized critical disasters that exceed the state's ability to respond, that are overwhelmed, these are the funds that support. This pandemic has been the first time in US history that has made this nationally declared presidential disaster. When we saw this happening at the beginning, we saw many civil rights being waived. We have the civil right to informed decision, and very specifically, equitable communication. How many briefings at the federal level and the state level and the city and county did not have ASL interpreter next to them, and some still don't. There needed to even be lawsuits to the president for it to be added. More personally, the right to have someone, even if it's an ombudsman, support me if I need support in an institution or getting out. For almost a year at the beginning, in many states, no one was allowed in. When disasters happen, traditionally, so for example, in Texas during the winter storm earlier this year with Hurricane Ida in Louisiana, we have additional disasters declared for that area. In this case, and with the pandemic, with the emergency, public health emergency, there are two major civil rights that sadly are being harmed. Our right to have a 3-day hospitalization before we are put in an institution is waived. And from your house, they may take you straight to a nursing home immediately after a hurricane or wildfire, for example. And now during the pandemic, they could do this in states that have care.
Crisis standards of care.
Thank you, Shaylin.
And just to add to this, what this waiver is called and is enacted during federally declared disasters or public health emergencies is the 1135 waiver. And this is what waives the pieces that Herman just mentioned and is quite honestly a fast track to a nursing facility. We oftentimes see people with disabilities being institutionalized after disasters because shelters don't know what to do with people with disabilities because they did not plan with us. And so they then think that the next best solution is to send us to institutions or nursing facilities and other types of institutions. And we all know that our right should be to the community with home and community-based services, especially for for folks that are within the community prior to the storm, and that the storm then forces folks to, or disaster to a nursing facility is another disproportionate impact. And as we all know, once you are in a facility or institution, it is that much harder, twice as harder, if not much more, to get out. And with our Olmstead decision and the right to have be in the most integrated setting appropriate to our needs, certainly this is another violation of that. I don't know, Melissa, if you'd like to add anything else. Or Priya.
This is Melissa. Yeah, I just wanted to say the federal government, CMS, is literally waiving its obligations during the disaster because it's a disaster. So what can happen? Shaylin talked about the fast track to institutionalization. It could be the hospital's full and you're in the emergency room. So it'd just be easier to send you to a nursing home. And particularly in times of COVID, we all know how dangerous it is. It's always been dangerous, but nursing homes are even more of death pits than they were before. And we'll talk about that later. Also, you could call an ambulance because your personal assistant didn't show up. And at some point they could just decide to send you rather than to a hospital. They could decide to send you to an institution. So that's how people get fast tracked to institutions. Or you could be in the hospital and they could decide another patient needed the bed more, having nothing to do with your health. And these are all guidelines that are in writing, and bump you into a nursing facility, an institution. Those are just some examples.
This is Shaylin. Thank you, Melissa. And certainly we will touch upon more of that. And actually on our next slide, we're going to show a brief video clip, and it is just the trailer of a documentary titled The Right to be Rescued. And this film was created by Rooted in Rights. And there are plenty of resources. We did add also in this slide the link to the full documentary. And this piece clip really highlights sort of the ongoing disproportionate impacts, the systemic issues that people with disabilities face during disasters, and sort of the false expectations that some of these planning pieces that emergency managers may think are a solution for us, rather than planning with us and knowing that it is not, that some of these actions that they take in preparation for disasters actually harm disabled people. So this clip is just a minute long, and it will be added after, it is on the platform as well for folks to check out, and really encourage everyone to watch the full documentary as well. I will let Priya press play. And want to make note, Priya, that you do have to have your mute button off so everyone can hear. We do not
I do
hear.
apologize. I'm not hearing any sound.
Hey Priya, if you could just please stop sharing screen and then reshare screen and make sure that the little check mark in the bottom left hand side is checked. Okay, perfect.
Yep, I had done that. My apologies, technology. Okay, I am not getting any sound at all. Maybe if we do it like this.
It was when the levees broke and water came.
Thank you for bearing with me with our technology.
A flooded New Orleans intercut
Please
with
let us know
various
if you can
interviews.
hear it.
It was when the levees broke and the water came that the problems really started occurring.
No one knew what to do for the city in general, let alone a population of people who are normally overlooked.
For people with disabilities, the impact is greater.
I just laid there for 5 days and watched helicopters fly around the building.
I said, Benny, what are you doing still there? She said, they've abandoned me.
When you know in advance who is likely to be the most harmed by a disaster and you don't do anything about it, then that is a choice. It's about whose lives are more valuable and which ones aren't as valuable.
Water recedes, revealing the text The Right to be Rescued, a Rooted in Rights original documentary.
This is Shaylin. Thank you, Priya, and thank you all for bearing with us while we navigated the technology pieces of playing that. And I know it is a short clip, but it is kind of a teaser to hopefully get you all to click on it later and check out that film. And I think the documentary is just a little over an hour long, maybe less, and is certainly worth the watch, and really encourage folks to check that out and certainly share within your networks as well. Next slide, please.
This is Priya. As we're moving to the next slide, I would just add it's a great watch. It does a fantastic job of really sharing on the ground experiences of disabled people. So if you're interested, or if you're wondering what it's like for folks who need to evacuate but can't, or who want to evacuate and went to a shelter, but that's not great. This is a great video to sort of show that and some of the barriers as well.
This is Shaylin. Thank you, Priya. Couldn't agree more. It's a great tool for educating others as well that may not be familiar with the important issues that we all have been talking about today, and certainly that we all continue to raise within our communities. This film also highlights what is on the slide now, which is titled The Reality. And we have 2 bullet points. One reads, false expectations of, quote, registries and, quote, special needs shelters. And the second bullet point, as we have already highlighted as well, is the institutionalization during disasters and emergencies. We'll go on the first part, which is the false expectations of, quote, registries and, quote, special needs shelters. And we put these in quotes because, quite honestly, these are one of the quote unquote solutions that emergency managers feel are a solution for people with disabilities to not be left behind, but oftentimes we find that then it is the way that people with disabilities fall through the gaps and the cracks and get left behind in disasters and emergencies. The first piece is registries. A lot of times emergency managers are thinking of ways to be inclusive and try to make sure that they are thinking of people with disabilities in times of response and recovery. And one of those solutions, ideas that has come about is the need of registries. And these registries are, and certainly there are many types of registries, generally speaking, and we are not speaking about those general registries for other types of needs. We know there's many types of hotlines and other resources. We're talking specific types of localized registries in times of disasters for people with disabilities to sign up to tell their local emergency management or their locality that they are a person with a disability, that they have access needs, or perhaps are power dependent, perhaps needing electricity for durable medical equipment, and any other types of sort of disability related needs that would need to be prioritized in a disaster. So these registries can be specific to making sure that there is a list of disabled people in your area for localities to check off and check in with folks. However, oftentimes, as we all know, we are mobile people with disabilities, and we're not always at our homes and not always at home when a disaster strikes or afterwards. And so also the connectivity certainly of reaching folks if you are not in that address that is identified on a registry can be problematic in that response. Another use of these registries is to and can be for certain localities is to sign up for what is called, quote unquote, a special needs shelter. And this is another solution that emergency managers think is a good one for disabled people in disasters. And we call it segregation because it is a way to kind of have a solution for when we all forgot to make sure that all of the shelters or some of the shelters were accessible to everyone, all of the general shelters in disasters. So oftentimes then emergency managers will set up what are called special needs shelters that can either mean it ensures that there is power at that shelter for somebody that may need to plug into an outlet, or it could mean that there is medical support there for people that may have specific medical complexities or medical needs after a disaster. Oftentimes we find, though, that people with disabilities that may not have power dependency, maybe don't have specific urgent medical needs that need addressed at that moment, are trying to access general shelters, general population shelters that everybody else is going to. And if they are not accessible, or sometimes they are accessible, but the managers of that shelter got instructions that all the disabled people go to a certain shelter somewhere else. And so oftentimes we find disabled people are rerouted to the quote special needs shelters, and then oftentimes can find difficulties entering those special needs shelters if they have other family members with them. There's oftentimes a limit on the capacity of folks coming into those shelters. So we see families are then separated, and oftentimes a lot of institutionalization, that's where that occurs during disasters, is once there's a sense of recovery and shelters are starting to close, especially the special needs shelters. There are oftentimes lack of housing, as we all mentioned earlier. That ongoing systemic advocacy need for housing certainly does not disappear during disasters and is disproportionately impacted. And when we don't have housing available, a lot of times we often find, as we do in other times, that people with disabilities are institutionalized. Anything my team would like to add? I know Melissa perhaps would like to mention about a report from the National Council on Disability that we helped write on the institutionalization of people with disabilities in disasters.
Sure. Thank you, Shaylin. This is Melissa again. First of all, I just want to highlight what Shaylin said, and I just want to say it in a couple words real quickly. Registries don't work. People tell you, we have a new and improved registry. Registries don't work. They harm us rather than help us. Special needs shelters are segregated, and people with disabilities end up in bad situations because of special needs shelters. And sometimes they end up being institutionalized because of special needs shelters. One of the things that the partnership was awarded a grant to write the proposal for a document called Preserving Our Freedom, which we did a couple of years ago. And Marcy Roth and I worked on that. And Preserving Our Freedom, where we got to do a really deep dive on what happens to people with disabilities. How do we get disproportionately institutionalized during disasters and emergencies? And what happens is, first of all, nursing homes aren't required to keep the minimal data set that they usually do. So we don't know how many people go into institutions specifically. We don't know why they go into institutions. We send a Freedom of Information Act request out to Centers for Medicare and Medicaid. And they did not, they said, we don't know, we don't track these things, but we know we can demonstrate that people, and there's some graphs in it of how people with disabilities are institutionalized more frequently after disasters. Oh, and by the way, everyone in a nursing home has a disability. You don't go to nursing home because you're old. You go to a nursing home because the community isn't meeting your needs. So just know, when we're talking about people that live in nursing homes, we're talking about some people that are old and have disabilities. And we're talking about some people that are younger and have disabilities, because that's who ends up in nursing facilities, psychiatric institutions, and other institutions. There's a huge uptick around institutionalization. And what happens when people get institutionalized? They get sick, they die, they get isolated from their family members. All of these terrible things happen. Now, we had to make the persuasive argument that bad things happen when people are institutionalized when we work on this document. Now we don't with COVID. It's kind of abundantly clear, sadly abundantly clear, unfortunately abundantly clear that people get sick and die in nursing institutions. That was always the case, but COVID has really highlighted that. So the reality is we end up in institutions. And one of the things that happens, and you read about this summer, where people go to institutions during disasters and get separated from their families. So what's happening is, right now we have the pandemic, and we also have concurrent disasters. So we have a hurricane like Ida, people end up in institutions and separated from the families. People end up dying in institutions from COVID, from situations from the disasters. So it's just really horrific. It's ableism in the utmost sense of the word. And were dying in droves in institutions. And I'm sure you all know that, but we just needed to say that out loud and make it a reminder that it's worse during the pandemic and it's still worse during concurrent disasters. Thank you, Shailene.
This is Shailene, and thank you, Melissa. Certainly, I encourage folks to check out that report, and we did add that to our resource list as well. That's on the conference platform, and use it as a resource, as an advocacy tool, and certainly don't hesitate to reach out if you have any questions around it.
This is Herman. Earlier on the Q&A, Carlos Santos shared in the observations what has been a glaring gap in emergency preparedness response that the recent pandemic has exposed regarding people with disabilities. Emergency management deals with all aspects of cross-sectorial life, as when disasters happen, all activities get impacted by it. Public health goes hand in hand with emergency management. We have seen that people with disabilities have been considered essentially extra, expendable. COVID has killed over 725,000 people in the United States. 98% of them have had comorbidities. In other words, disabilities. At least 40% of people who have died have been in nursing homes and congregate care settings. And for lifetimes, people with disabilities have been advocating against nursing homes, calling out the dangerous situations they are in. And now through the pandemic, GAO has done a number of investigations demonstrating the lack of preparedness over decades in these facilities. A few weeks ago, CNN medical contributor Sanjay Gupta said, we can look at nursing homes as the example of what will happen in the large community in relevance to COVID. As if, Melissa will put it, we are the canary in the mine. When earlier we shared that people with disabilities die or are injured 2 to 4 times more than people without disabilities during a disaster, we have known this in hindsight. This data comes specifically from following the 2011 Fukushima earthquake in Japan. The data was collected, and this is our impact. This is our lives. Emergency preparedness, public health, the issues around mitigation, recognizing the gaps that have been long-standing have fallen through the cracks. At the end, towards the end of our presentation, we'll share some federal bills that we mentioned earlier, the Ready for Disasters and DERMA, which will help alleviate some of these gaps. But essentially, we need to, as we know with infrastructure, have people with disabilities and our needs incorporated from the build up, from the foundation up. Otherwise, we end up being segregated and marginalized.
This is Shailene. Next slide, please, Priya. So now, oh, no worries. Now we want to talk about the roles that Centers for Independent Living and statewide independent living councils play in disasters. And certainly want to really highlight that CIL's core services are vital during disaster response. You are responders, and hopefully, if anything, this is one takeaway that you all have and empowers you in your community to view Centers for Independent Living, statewide independent living councils as responders when disasters strike. When you are providing your information and referral resources, certainly at any time, but especially during disasters for people with disabilities in your communities, is a vital resource and is a first response activity. the peer support that you provide in times of crisis, especially during this COVID public health emergency, is vital for our communities. And the ongoing education and advocacy that we all do individually with individuals and systemically through systems advocacy is more important now than ever, and certainly especially during disasters and emergencies, as we've spoken upon the disproportionate impacts, the roles that you all play in your communities is very important, and is why it's so needed for SILs and SILCs to be involved and playing a key role in these response activities and being at these tables. Next slide, please. And an early advocacy result to that end of ongoing advocacy, not only locally, but nationwide, is we at the partnership have been holding a daily COVID-19 disability rights call each and every day since February 28th of 2020. When I say each and every day, I truly do mean it. Weekends, holidays, birthdays, all of the days of the week, we have been meeting since February 28th of last year. Soon we will be upon 2 years meeting every day, and specifically on the rights and needs of people with disabilities during this public health emergency, systemic solutions and advocacy tools and resources, and peer support for one another. And that call is each and every day at 6 p.m. Eastern time. And certainly we have information for folks to join us on those calls if you are interested when you can and are able to. And from these calls, we've done a number of advocacy related documents and tools and put out many resources for organizations, Centers for Independent Living. And one of the main things we saw early on throughout the pandemic was the need for Centers for Independent Living to be identified and recognized as essential services and workers during the COVID-19 pandemic. If we all remember back in the beginning or towards the beginning of 2020, there was when we were all facing what we called lockdowns, shutdowns, whatever they may have been called in your area, and that only essential workers were able to sort of move throughout the community and go out. And certainly we saw that Centers for Independent Living are vital. As we mentioned just previously, you all continue to provide core services throughout disasters, and it does not stop. And the need for SILs to be recognized as essential workers and services during the pandemic was successful in many communities throughout the nation. Next slide, please. And some good and promising practices that we've heard from folks across the nation, from Centers for Independent Living, doing response work during the pandemic. One thing, as Herman mentioned early on, that this is a nationwide federally declared disaster. This is something that's impacting all of us across the nation, no matter where you are, certainly around the world as well. But as we are speaking about United States focus, the work that we all do certainly is ramped up and has been throughout the pandemic. And some examples that we've seen of Centers for Independent Living's response during the pandemic is being a local information and resource hub, just being there for the community. And maybe a lot of Centers for Independent Living have seen new people with disabilities contact them because they are looking for resources near them. So being that resource hub and that point for information and reliable information has been so vital for Centers for Independent Living in different communities. Being a mask and sanitation distribution site, or having those resources, being able to mail those out. We've seen Centers for Independent Living do many different ways of getting those types of resources, masks and sanitation supplies out to our communities during this disaster, where many times we're seeing that people with disabilities fall through those cracks of getting that personal protective equipment, as we all know, that PPE, and also the need for masks for people that are deaf or hard of hearing, being able to have a transparent mask. And providing these solutions and bringing up these ideas to our emergency managers. This is one of the key roles that SILs play during the pandemic. We've also seen SILs be food banks for their communities and for people with disabilities to come and access food, and in partnership with food banks in their communities. We've seen SILs become a COVID-19 distribution site for at-home tests for COVID-19. Some centers for independent living are acquiring testing kits from their public health officials or emergency managers locally, and then being able to distribute those at-home tests for free to their community, people with disabilities who maybe do not have access to go to a testing site, perhaps just the need to have one of those at-home tests available at home with the influx of personal attendant care workers coming in and out of people's homes and wanting to make sure that folks have access to rapid testing available if symptoms arise. And we've seen that being a really great resource for folks, especially as the access to testing sites has become a bit different over the course of the pandemic now that the vaccination sites are in place.
Many of these efforts have been in collaboration with the local public health agency and, if need be, the emergency management agency. So it is critical, if you have not yet, to engage them. And if you need support in that, you certainly can reach out to us. Sheila and I first got engaged and delved headfirst into inclusive emergency management following Hurricane Maria, as we were deployed to Puerto Rico and saw firsthand the large gap and the need for centers for independent living to be, as they have now been recognized as essential critical workers. With the, as it were, a fire crossing through nursing homes early in the year, as we saw last year, we began advocating for FEMA to support centers for independent living in providing emergency relocation services. FEMA has a guidance, the public
Public Policy Program Guide.
And there are a number of eligible private nonprofits that FEMA then supports economically in reimbursement for a number of services. Through last year, through the summer, with the support of the National Council on Disability, we had roundtables where FEMA was engaged, and an addendum was created where personal assistance services and centers for independent living can be a eligible private nonprofit. We have been supporting a center for independent living in rural North Central Pennsylvania, Road to Freedom. And just a couple of months ago, after a year-long, and yesterday some of you saw that presentation, now a center for independent living has been recognized and obligated funds for emergency nursing home relocation during a disaster. It is an example that we want and needed to propagate as far and as wide as possible.
And with that, I do want to ask everyone that is with us, if you don't mind sharing with us any additions to this list that you may have done as response work during the pandemic. Please feel free to add your work in the chat or in the Q&A. We'd love to hear what else has been going on out there in the community to assist people with disabilities during the public health emergency. So love to hear other examples as well. But let's, in the interest of time, let's move to the next slide, please. So as we mentioned earlier, some of our support as the Partnership for Inclusive Disaster Strategies to Centers for Independent Living during this public health emergency, and certainly throughout every disaster that occurs in our localities, we always reach out to the Centers for Independent Living in the impacted areas and surrounding areas. to touch base and see how we can support. But I also want to make sure that folks are aware of our disability and disaster hotline. And I apologize, the number is not on the screen, but it is in the resource list that is on the platform, the conference platform that you guys can check out, also on our website, disasterstrategies.org. And our disability and disaster hotline is a resource hub for people with disabilities, organizations, family members, allies, and anyone needing assistance or support for disability and disaster related needs in times before, during, and after disasters and emergencies. And we act as a resource connection hub for people to connect with resources closest to them by calling our hotline. And we also work with many partners across the nation, especially centers for independent living outside of the impacted areas that are able to assist us in addressing the hotline calls that come in and making sure that folks are getting the resources they need right when they need them. And certainly do please reach out to us if you're interested in supporting our hotline in any way. We always welcome partners to help us continue to spread that word and also make sure that we're addressing those needs. And as I mentioned earlier, our daily COVID-19 disability rights calls each and every day at 6 p.m. Eastern time. And we also hold a weekly national stakeholder call on Tuesdays at 3 p.m. Eastern time. And folks, please don't hesitate to reach out to us. Our information and contact information is included, so you should all have it. And we really hope folks reach out to us. And we also provide technical assistance for centers for independent living organizations in supporting people with disabilities during disasters. And we provide a number of community resilience initiatives, one being an initiative specific to COVID-19 pandemic and emergency management and people with disabilities and the centers for independent living that serve them. But also, and I'll call on Melissa to elaborate more on our gap analysis and continuity of operations plans and our other services that we provide.
Thank you, Shaylin. What we do, our gap analysis and continuity operations plans kind of come together. A gap analysis is when we go into a center and we look at your gaps around emergency planning. Are you drilling? Do you have backup? Do you have these kinds of things? Because one of the things, centers need to be able to function during emergencies and disasters, including COVID, but also concurrent disasters. And hopefully the pandemic will be curbed at some point. So there'll be non-concurrent disasters that aren't the pandemic. So at a gap analysis and a continuity of operations planner, we go in and do an interview with the center staff, with their IT people, sometimes with their financial people, maybe a board member's interested. And we talk about how well is your center set up to protect the lives of its staff and consumers in the building and members of the public in the building or people that it's serving during emergencies and disasters. We look at those things and we provide a gap analysis. Here's the gap, here's our recommendation. And it's not coming from a you're bad, you have no one gets 100%. If you get 100%, we shouldn't be there. Everyone has gaps, that's what it's like, that's okay. Continuity of operations, we focus on how your center can continue to operate during concurrent disasters, during the pandemic, what you need to do, things like where do you work at home policies, how do you do those things? And now, a year and a half later, we're looking at it from a slightly different lens. What do you need to do given that people are somewhat back to the office or maybe not fully back to the office? How can you do this smoothly? How can you do this and still comply with your obligations under other laws like HIPAA? We don't do HIPAA analysis, but we mention things like that in that. We bring that to the forefront. So those are some of the things that we look at in the gap analysis. The trainings, Shaylin, I think you wanted me to talk about that too, is we have an initiative where we have a community access initiative, enduring disasters initiative, I'm getting the name of it wrong. And we have, I want to say, a 6-module series that has everything from emergency management basics, how SILs can continue to provide services during the pandemic like you're doing, but how you can do it more and better because the pandemic keeps evolving and changing as we learn more, the science is progressing, all of those things are happening. So how you can do those things, how centers can help out with the vaccination process. We look at all of those kinds of factors. And I think those are all really important things for centers to know. We have a module on What's the hard truth the centers need to know? Things like registries don't work, institutionalizing is a thing, and we go on at length about all of those things. And we do conferences. Right now, we're scheduling a conference that's going to be in the first week in November at Delaware. And we did one in Washington State. And we pull the community together depending upon your objectives and your initiatives and around emergency response during disasters. Thank you, Shaylin.
This is Shaylin, and thank you, Melissa. Let's go to the next slide, please.
This is Priya, and as we're going to the next slide, I just wanted to quickly read some answers from the chat from folks. Vilma says that they're still use curbside home visits and as a way to support their consumers and their sills. Another individual also says we've done 72-hour kits and have preparedness classes, which is fantastic. Definitely need to educate our community on emergency preparedness. And Carlos adds that their center was asked to set up a shower site for the homeless because the rec and community centers shut down. Thank you all for your answers.
And I know that Gavin also wrote around issues in his state and long-term need for housing and being kept in shelters. In the last slide, we have our contact. Our email is directors@disasterstrategies.org. Feel free to reach out to us. We'd be happy to collect more of this so we can share it with federal partners and with the community wide. In the last minute, I'll quickly go over the Real Emergency Access for Aging and Disability Inclusion, READY, and the Disaster Relief Medicaid Act. READY in the Senate, S2658, HR 4938 in the House, and DERMA S2646 in the Senate, and HR 4937 in the House. Real easily, DRMA is money follows the person in a disaster. You have Medicaid or you qualify for Medicaid, health and LTSS, HCBS, your state will be funded at 100% for 2 years after a disaster. If you relocate to a different state or county, your services will follow you and HHS will support that new provider with all of the services you had. And READY will create 20 nationwide, based on the regions, training and technical assistance centers and research centers for people with disabilities and disasters, as well as doing a GAO and a inspector's office assessment on the mismanagement of funds going back to Hurricane Katrina, and with a lens on the gaps for people with disabilities. There are much more, and you can find out more on both bills at reaadi.com.
And this is Shaylin. We really encourage folks to let us know your questions. I know that the folks at April will send them to us if we didn't get to address them today, and we will reply and they will be added. I know we are at the top of our time, and we really appreciate everyone tuning in and certainly adding your contributions and feedback. Please don't hesitate to reach out to us. All of our contact information is here and available to you all. And thank you all for joining us. Please stay safe and don't hesitate to reach out. Take care, everyone. Thanks for joining.
Thank you all so much. We sure appreciate you, and thank you to our interpreter team and our cart operator. See you later on in the conference.